Queensland health authorities are trying to find out how Australia's youngest coronavirus victim became infected in a town with no known cases. Here are today's COVID-19 developments. A fever clinic has opened in the central Queensland town of Blackwater after the death of Nathan Turner. He was found dead on Tuesday and later tested positive to the virus. Anyone experiencing COVID-19 symptoms is being encouraged to be tested. The Melbourne meatworks at the centre of Victoria's biggest outbreak is returning to full operations today. Cedar Meats has been linked to more than 110 cases, but there have been no new infections in the past week. The number of deaths from coronavirus in the United States has surpassed 100,000. The number of confirmed cases there is almost at 1.7 million. The World Health Organization has launched a foundation to raise money from non-traditional sources. That's after US President Donald Trump threatened to permanently pull funding. And New South Wales ski fields will be able to open from June the 22nd. Work is underway to ensure appropriate safety measures at Thredbo, Charlotte Pass and at Perisher. Queensland Health is opening a third coronavirus testing clinic in the Central Highlands this morning as contact tracers scramble to understand how a local miner contracted the disease. Reporter Rachel McGhee joins us now from Blackwater. Hi Rachel, so what do we know about Nathan Turner?
We know 30-year-old Nathan Turner had symptoms of the virus for several weeks, but it remains a mystery how and when he contracted the virus, as we know he didn't leave the town of Blackwater for more than 3 months. And as we heard, the town has been COVID-free, so we thought, up until now. Mr. Turner was a miner and hadn't been at work since November last year, though, due to an underlying medical condition, which we now know was work-related.
And what's happening in Blackwater, where you are this morning?
An emergency fever clinic has been set up here at the Blackwater Showgrounds, and behind me cars of people are being tested. There was a long line out the driveway earlier before the fever clinic opened, and people have been coming and going throughout the morning to get tested. The region is quite well equipped to deal with the current situation, with fever clinics in Emerald and 2 here in Blackwater now, and people are getting tested as being recommended from the Chief Health Officer. We know Mr. Turner's partner also is in self-isolation here in Blackwater, and first responders who responded to the incident, police officers and paramedics, are also in quarantine and have been tested for the virus as well.
So Rachel, this news broke yesterday. Nathan Turner died on Tuesday. So where is the investigation up to today?
Queensland Health have confirmed that a second test of Mr. Turner after that initial one returned negative. However, the Chief Health Officer says that that test is being classed as invalid due to a poor test sample. We will know more, however, once the full post-mortem is conducted. There's also been talk that this case could be linked to that of a Rockhampton aged care nurse who tested positive 2 weeks ago. However, Queensland Health is investigating and says all evidence so far suggests that these two cases aren't linked due to the timeline of when that nurse visited Blackwater and that Mr. Turner was already showing symptoms before then.
OK, Rachel, thank you for the update. Well, health authorities are investigating after a worker at Melbourne hotel was diagnosed with coronavirus. Reporter Elias Clure joins us now from Melbourne. Elias, are we any closer to knowing how the worker contracted the virus?
Yeah, good morning, Ros. Well, Ridges Hotel in the city has been closed to the public for 8 weeks now, but has been used to quarantine return overseas travellers. So this is being investigated, and so far we have no idea how the worker contracted the virus. However, they are in quarantine, as well as several of their close contacts, including some staff members. The hotel is also being thoroughly cleaned. They were one of 8 confirmed cases yesterday. It also included 2 workers at an aged care facility in Melbourne's east and 4 people that underwent routine testing. However, the Victorian Premier Daniel Andrews says the state's slowly getting on top of the virus, with 200,000 tests conducted since May 11.
And the meatworks at the centre of Victoria's largest cluster will resume full operations today.
Yeah, that's right. Well, the government is urging people to continue working from home if they can, but some workplaces are reopening, including Cedar Meats, as you mentioned. Of course, it was the site of Victoria's biggest coronavirus cluster with 111 confirmed cases linked to the abattoir. However, the general manager of the facility has said that 300 workers have been cleared to return to the facility this morning, which they are, and the public health authorities say they are confident that it's safe to reopen. Ros?
Elias, thank you. The Prime Minister has been urged to step in to try to prevent the New South Wales government's public sector wage freeze. The federal opposition says it's a slap in the face to workers who've kept the country going during the coronavirus pandemic. Political reporter Jade MacMillan joins us now from Parliament House. Hi there, Jade. So what's Labor had to say?
Well, the Liberal state government in New South Wales wants to freeze the wages of more than 400,000 public sector workers. It says pay rises just aren't sustainable at the moment in the wake of the COVID-19 crisis. And it says that it'll free up around $3 billion that can be put towards creating new jobs. The federal Labor leader, Anthony Albanese, though, has weighed in. He says that this is an outrageous slap in the face to workers such as teachers, nurses and police officers who've done so much during this pandemic, and he's called on the Prime Minister to intervene.
It is unacceptable. And I say to Scott Morrison, don't just give a speech at the National Press Club saying that you recognise that working people actually have a role in our society. Step in here, pick up the phone to the New South Wales Premier and talk to her about why this is unacceptable.
Jade, what's the latest on the stash over state border closures?
Well, this is an ongoing dispute between various states and the federal government over when those border restrictions that were put in place at the height of the pandemic should be lifted. Now, there are a couple of other high-profile people who've also become involved. The billionaire Clive Palmer is expected to ask the High Court today to consider a challenge to Western Australia's border rules. He lodged that application after being refused an exemption to travel to WA. One Nation Senator Pauline Hanson has also threatened to challenge Queensland's border restrictions. Now, the federal government insists that there is no expert medical advice to the National Cabinet that suggests that those border closures should be in place. Prime Minister Scott Morrison will meet with state and territory leaders at National Cabinet tomorrow.
Jade, thank you. There are now more than 100,000 recorded deaths from coronavirus in the United States. More than 5.6 million cases have been reported worldwide, with close to 1.7 million in the US alone. The United States accounts for more than 1/4 of the global death toll from the virus. The World Health Organization has launched a new foundation to raise funding from non-traditional sources. It comes after US President Donald Trump threatened to permanently pull money from the global health body. WHO Director General Tedros Ghebreyesus says the foundation hopes to broaden its contributor base.
Most of the funding we get, which is 80%, is not flexible. It's earmarked, and our discretion to use it based on other priorities is really limited. So that's why we said, I think in order to improve flexibility, we need to have additional resources and unearmarked resources, and this is a good solution and we have to pursue. So this has many benefits, as I said, and it has nothing to do with the recent funding issues, but this is something that started with the transformation that can help the organization or WHO to improve the quality of funding, to increase the amount of funding, to serve the people we serve in a better way.